Now, once you've conquered one of your anxieties, you move on to the next one. The next one on your list that is the least anxiety provoking. And you work your way all the way up to the one that's number 10. When you're stronger and you know how to do the process and you learn how to manage your fears. And once you have your coping mechanism of how you can deal with the obsessive compulsive rituals and anxieties, and new ones pop up. Like I said, sometimes there's a trauma in one's life that brings it all back again. Sometimes it can pop its ugly head up again. You'll know what to do. You make the list and you just start attacking it. And you start learning coping. Everything in life, I think, learns coping mechanisms. And when you learn those coping mechanisms, you can change your behavior. You can change the way you deal with things. We do that all the time in life. Humans are incredibly adaptable. You can make it happen for yourself. You can conquer this situation so that you can lead a productive life. You can have loving relationships, and your children can be happy if they're suffering from this type of an anxiety. You don't have to feel that there's no hope or it's out of control. There's hope for you out there. There's help for you out there. There's so much out there. There's so many books on this and so much on the web. And there's doctors willing to help, therapists willing to help, pediatricians willing to help. Now, for any of you out there who do just have mild or moderate OCD, you might be able to handle this on your own without the help of a therapist. But for those of you that are not sure and want a therapist's opinion, I would recommend that you do go and speak to a person who is trained in this area. See someone who is experienced with OCD. Not just any therapist or clinical psychologist can help you with this disorder. It's definitely something that you need to be trained in. And you might want to speak to your family doctor to get a recommendation. If you can't find a recommendation, there are foundations, and I'll put them up at the end of the video, that you can go to. One of them is the Obsessive Compulsive Foundation, and I'll put them up at the end so that if you need to find more information about obsessive compulsive disorder, or you're looking for a therapist, there are people who are listed on these websites or in these foundations that you can go to and find someone in your area. If you have no family members to lean on or to help you with your therapy, you can find support groups. There are so many people out there that have this, so you're not alone. I really recommend reading, getting some books at the library. I spent quite a few hours reading about this because of interest, and like I told you, it was spurred by the woman that I saw checking the doors of her car before she got out. And I thought, wow, a lot of people have this problem. And now when I think back, I actually remember some children that I came across that my kids were friends with. The parents used to have issues with their kids. And, you don't really think about OCD as the root of the cause of a situation with a child or something until, you really start thinking about it or reading a book about it. And then you start to say, wow, a lot of people have this. There are so many people. I mean, you are not alone. And people joke about it all the time, and they say things are OCD that are not even really OCD. I mean, not everything is OCD. It's just, it's become such a common terminology. But the actual disorder itself is out there. So do some reading. There's plenty on the internet. The books are really helpful because they're written by clinical psychologists and psychotherapists and people who've had a lot of success. And what I'm sharing with you today are just things that I've read, and I know that I know someone who used this therapy that it worked for. So I know it can help, and I think you will find it very helpful. And at least it will help empower you, that you won't feel helpless, that there's nothing you can do about it, and you have to either live in secrecy or just engage, parents or friends or family or whomever it is that supports your problem with this disorder. And just recognize that it's not you acting like that, but it's this disorder. And like I said, there's medication that can help. You just have to see the right person. So I want to bring an awareness to you about it because I think it'll help a lot of people. And I hope you found it helpful. I hope that you will look into it. And please do subscribe because I have a lot more to come. A lot of things of interest to everyone, different topics. I love your comments. Thanks so much to all my subscribers out there for their support. And if you're looking for more information on my videos and want to read some more tips, please check out my blog spot because I do post there regularly with tips and questions that people ask me and things, answers. So thanks again. Okay, bye-bye now.